Today we're going to talk about the quality of your mounting. How are we going to judge your quality of mounting, okay? So most of you have finished mounting the upper successfully, and now you're going to work with the lower. So to ensure that the upper is correct, we're going to give you some guidelines on how to judge your arbitrary mounting. We are using here arbitrary mounting, meaning that we are using only a mounting jig. We are using the wax rims made to the average values that we have given you. And we're going to mount according to an average value articulator, the articulators that you have, okay? So if I look closely at my mounting, I'm looking at an articulator with casts attached to it, okay? So I'm going to talk about this attachment. There are some general outline or rules that we need to observe while we're working with the articulators and mounting. We need to make sure that all of the articulator members are clean. So this is what we're going to judge you by. So if you write down these notes, it will be useful for you to mark yourself before you come and you evaluate yourself before you come to us to evaluate you. Okay? So we're looking at general points. These are the cleanness of the articulator. We want your ID clearly written. So please write your name on the side of the cast, on this side. We want the articulator itself to hold a name tag like this. See this name tag? Okay? So we have a name tag attached with your name on it. And we also would like to see your name also on the base plate itself. Okay, so if this was a base plate, okay, this base plate, I would like to see your name. It's preferred to be on the bottom of the upper and the lower, on the fitting surface, okay? So it's on the fitting surface. So write down your names clearly on each part of your articulator and your work. This will be easy for us to identify you. If one of the IDs is lost, I'll have another one to recheck, because marking and marking students and making sure that they are clearly identified is important with this large number, okay? So make sure you write down your names correctly. We also want to see that the casts at all time are clean. We are looking, because you're using plaster, and plaster you have cleaned it and wiped it away and try to manipulate it so much, so you will have a lot of areas that we need to have clean after all of this. And these are the articulators. The cast should be free of plaster, and the wax rims and base plates should be free of any plaster. Okay. Now for the upper, how we're going to judge the mounting of the upper. If we're going to look at the upper, the first thing we need to check is the midline. So I need on each cast to have a clearly drawn midline on the cast and on the wax rim, to make sure that this midline is corresponding with the midline reference on the articulator. What do we have as a reference here on the articulator for the midline anteriorly? What do we have on the articulator? Do you see this notch? The V shape notch on the jig itself? This determines where is the midline. So this is our reference for the midline. We have another reference, is the ring, the incisal pin itself. We make sure that the midline on the wax is corresponding with the incisal pin. And we also sometimes have a pointer. Does anyone have the pointer? Which is like a nail that goes through this hole. It's a black nail. Do you have any one of you? Pointer. Okay, please give it to me. So what is the pointer? You have midline pointers and you have what we call infraorbital pointer. We're talking about midline pointers. You'll take these information of parts of articulator in the lecture, but this is the midline pin, or indicator, or a pointer. So it goes through this hole in the incisal pin. You all have it in your boxes, but recheck your boxes. And we orient it in a way, we try to tilt it in a way where it's heading immediately to the midline. Okay, why do I need it as an extra? Because the incisal pin is far away from the midline. We want something closer. This is one reason why we use it. Okay, we want something closer to the wax rim. And remember that in the second step, we are going to remove this jig. So we no longer have this reference as a midline. So we use the pointer as our midline. Okay? So the pointer will be indicating where is the midline. So during the setting of the teeth, I don't lose it, because also the wax midline will also be removed. So we're looking to make sure that the midline is centered. Remember, I'm going to revise with you a bit how we drawn this midline. We have drawn this midline using a pencil, as you remember. Or pen. Okay. So remember how we have drawn it on the cast, on the upper cast. I'm going to revise it with you to make sure that you really understand how we determine an internal midline. We're going to call it today an internal midline, meaning that we're using the cast as a guide for the midline. It's not from the patient's face. Do you remember in the lecture when I told you we use external midline, we use the symmetry of the face around the nose, around the midline of the face. We try to take a line, and that line we extend it to the wax rim. That is showing through the upper lip of the patient, so when the wax rim is in his face. Today we're not going to use the external reference midline. We're going to use an internal, meaning from the inside, from the cast. We're taking it from the cast. So we really need to understand in the pattern of resorption, other than what we said about the direction of the crest of the ridge. You remember resorption and the issue of resorption and the directions of resorption and where it happens in the upper and the lower. We talked about that. But also we need to make sure that within the resorption that we have, that tissue are changing in location, there are some features or structures inside the mouth that don't move no matter how much resorption happens. Okay? And these we call fixed points. And these have been studied. And if you see them on the cast, the most fixed point that has been studied is what we call the incisive papilla. No matter how much resorption happens around, this incisive papilla stays in the midline and stays in its location. So no matter how much the palate changes around this point, but this point usually stays fixed. We have another structure that does not move while resorption, which are the hamular notches. These stay stable in their place. So they can present for us the perpendicular line to make sure parallelism of the posterior line, for example. The third structure is the mid-palatine suture. This also doesn't shift. So from these 3 points that don't shift, no matter how much resorption happens, from these points we're going to choose points for the midline, and these are the incisive papilla and the raphe. Okay? So we want an anterior and a posterior reference to make sure what is the direction of our midline. And we said that we bring a ruler, we put it on those lines, we extend that line wherever we're seeing it on the cast, and then we put back the base plate in location, and then redraw the line on the cast, we extend it into the wax rim. So we have used an internal reference for our midlines. For the lower, it's a different story. And we're going to talk about why we don't use labial freni as references. Okay? يعني ممكن أنا أمسك الcast, I could hold the cast and say, why not use this as a reference, labial freni as a reference? I can't. Because labial freni are dictated in their location by the position of the musculature of the face, okay, and the lips. So suppose the patient has half of his face partially or completely paralyzed. What will happen to the tissue? It will all shift to one side. Okay? So the labial freni will shift to the side that the patient has weakness in. Okay? So they will not be totally in the midline. So we don't use upper or lower labial freni as references for our midline. Another reason might be have trauma. So we might have a trauma in any time of the age of the patient, at any time point in his life. He had a trauma to his upper lip or lower lip, a punch box. If he has rough sports, he's working with rough sports or any reason, any trauma to the soft tissue of the lips and the freni, this trauma will rupture the freni, the attachments, and we will have a shift in these attachments. So many times we find that labial freni are not in the midline. Okay? So we don't use them, neither in the upper or the lower. We have more reliable points to use, okay? In the lower, the more reliable point is what we find under the lingual frenum, okay? So the lingual frenum is a structure that stays stable in the midline as long as possible, okay? So the lingual frenum attachment in the bone, what do we call it? Tongue ankylosis is when we have a tight lingual frenum. It's tight, but naturally in all people, the lingual frenum, where does it attach in the mandible? Genial, tuberosity, or tubercle, صح? The pull of the muscle, the continuous pull of the muscle, those where we're using our tongues a lot, we will have the bone responding to this to have a tubercle there. So this is the point that we are referring as an internal reference in the lower. Okay? So once more, we extend it to the outside. We just use a ruler, centering the ruler between the two posterior points. And with this lingual frenum attachment, it's not clear on the cast you have today, but in the patient's mouth you will have it clear, okay, if you do good border molding. So this was an internal line, and we extend the lines to the outside, make sure that we draw a midline here. So we extend it, once we have it on the cast, we extend it to the wax now, and once we have it to the wax, we want to make sure when we mount the upper and lower, that the upper and lower midlines are corresponding with each other, okay? So I could use the reference from the cast and the wax rim here, or I could use the external line that we have got from the patient face if we have the clinical step, which we don't have because we're talking only about lab procedures in this semester. But if I have the midline from the patient's face on the upper wax rim, I extend it to the lower. Simply I extend the line and carve in the wax this line. I could extend it into the lower wax rim, okay? So this is how we determine midlines. So once we are mounting, we want to make sure that our mounting is correct. So what we're looking at, first of all, is the midline. Okay? So all of this was explaining only the midline. Midline of the cast and midline of the anterior wax rim should correspond with the articulator midline references. اللي هي notch in the jig, the pointer, or the incisal pin for the midline. But sometimes, even when I have the midline correct, let's watch this case, okay? So even if I am mounting, this cast is not mounted yet, but if I'm mounting this cast to the notch, this is how I'm locating it. I'm trying to put the midline on the notch. Try to give an angulation where you can see it on your screen. So for this cast, I'm trying to put the midline on the notch of the jig, okay? We have another reference that we need to focus on is the posterior midline, because I put my midline on the notch, but with this point fixed, I'm pointing it with a pen, okay? Try to let you see it. Okay, because your screen is from up here. Okay, I'm trying to put the midline on the notch. It's clear now, it's on the notch, okay? I'm fixing this one. But even when it's on the notch, the cast could go to the left and right, صح? So it's not only an anterior reference that I need for midlines, I also need a posterior reference, okay? Because your casts are made of a model, and that model is uniform on both sides, I'm going to use the cast itself as a reference for me, for the posterior orientation of the midline, okay? So if I'm looking, so my line is on the notch here. When we are going to judge your mounting, we are going to see in the posterior area, we're going to compare the distance between the metal of the upper member and the side of your cast. So if the cast is shifted like this, you're going to do a remount. Okay? So once we have finalized the midline of the lower is with the notch, we make sure, please, that you have not advance the cast to cover the notch. Do you see the notch? We don't want the cast, the wax rim, to cover this notch. We want it exposed. So anyone that has advanced his cast and covered the notch, even if it's on the midline, he will repeat his work. Because we want the cast in the center, around the center of the articulator, so we will have the setting correct. Then after judging the midline, we're going to judge the posterior edge of the cast. We want to make sure that when we're looking down, if you look down on your cast from up, down, we want to make sure that the distance between this side and this side is the same. Okay? It's not shifted to the left or right. So this is our second reference for the upper. I could also look at the upper from behind. Okay? So let's go back to the mounted cast. If I'm looking at this cast from behind, okay, try to give you a posterior view. I also could see that the cast, if I'm looking at the cast or looking at the ridges, this is centered. I'm trying to compare by looking down on this. I am trying to compare the distance between these ridge areas and the metal components of the articulator. This distance from here, from this point down, and this point down, if I'm looking totally vertically on this, it should be centered. So I also could use this, looking at the articulator from behind. The cast is not shifted to one side or another. You can see it here better with the unmounted cast yet. But watch here. Okay, this still is unmounted. But look how sometimes you have a shift. See this ridge compared to the upper member of the metal? Okay? يعني قارنوا الميتال مع الridge location. So this is shifted to the left or right. It's centered when the ridges are in equal dimension, equal distance from these metal members in comparison. It's not shifted to the left. It's not shifted to the right. Okay? So this is for the upper. This is how we are going to judge your upper mounting. Once you finalize your upper mounting, we will ask you please to take out your jig. So the mounting jig is now removed. We're going to replace it using the ring. We're going to replace the jig with the ring, the lower ring, please. Ring. So in your box, you will have rings to attach. So we're going to replace the jig by the ring, and we're going to attach the ring into location using, secure it with the screw. So we want to make sure it's secured. Many of you brought some types of articulators that are not that good quality. So even when they secure the screw, this is still moving. Those students, please come to me to tell them how to fix it. Okay? Some of you will still, even when you secure the screw as much as possible, this will be moving like this. If this is not secure, this is because of the quality of the articulators you have. If this is not secure, even when you tighten the screw, please approach us and we will tell you how to tighten it for our lab training purposes, okay? So we secure the lower ring. We invert the articulator. It's now upside down. And we're going to put in the lower wax ring, okay? So we're trying to put in the lower now. So if I suppose this lower is according to the dimensions and the quality we talked about, and you have used the hot plate to make it flat and it is corresponding with the upper, if I'm going to place this here, this is your side. Give me your wax ring. This is the one, this is your articulator, yes? So I'm going to place now my cast of the lower. How am I going to judge the lower? In location. How am I going to judge it? I'm going to go back and look for a midline. So any one of you that comes without any midline on the lower, we will also let you repeat the work. So we want a lower, okay, midline, internal reference, going outside on the cast, and extending that line into the wax rim. We want to make sure that the midline is corresponding with the midline. Now this is where the pointer comes in, the importance of the pointer. شايفين الpointer? Do you see the pointer? Now I don't have a jig to make sure that the articulator is in the midline. So the pointer will help me, okay? The pointer will help me always locate the midline. So I want to make sure that the midline I have drawn on the wax corresponds with the midline of the upper. A second reference that we need to make sure that is present is the overjet. Do you know overjet? What's the overjet? The horizontal distance between teeth, upper and lower teeth, صح? The anterior teeth are advanced in comparison with the lower. The lower are to the back, and the anterior teeth are to the front. So we want the wax rim, upper wax rim. This is the upper wax rim, but we have inverted the cast. The upper wax rim, more advanced than the lower. It makes like a step. Do you see the step? There's a step here. And the amount of this step, if you made your labial inclinations correct, it's 2 to 4 millimeters. So this is the upper, and this is the lower, and you see this step. See this negative ledge or step? It's called overjet. So when I want to place my lower on the upper, first of all, the midline should correspond with the midline. Second, I should have an overjet. And third, I'm going to look at the posterior side of the cast and try to center the cast on your articulator, okay? Some of you will tell me, why not use the wax to center? Yani, why not look on the side here and simply make sure, if I'm going to remove the yellow material that you've used for fixing the cast, why not make sure this wax on the side is centered over this? I will tell you no, because some of you as students have melted more wax from this side from the other side. صح? This could have happened in the upper or the lower. Yani, if some of you had made the upper more to the buckle on this side than this, so the mistake will mount up in the mounting. I don't want you to build on mistakes. I want you to build on correct work. So we're going to use the centering of the lower over the upper, not using the wax. We will not use the wax as a reference, we'll use the cast as a reference, okay? So once we place the midline over the midline, the overjet is present, we're going to make sure that this cast is centered when we are comparing it with the metal. So it's centered in comparison with the metal. And it's centered in comparison with the upper when we look from behind. Now we're going to go back and compare the ridges together. Okay? So we're comparing the ridges together. Want to make sure that the distance from this ridge, the posterior of the lower denture area, and the posterior of the upper are centered. So the mounting like this is incorrect. It's not centered. It's shifted to my left in this case. Okay? So we want to make sure that the heel areas, we call them these heel areas of the cast, are centered over each other. Then this is when I begin mounting. Okay? So I make sure that it's centered. There is a final point about interferences. If I'm going to mount the lower and it's hitting with the ring, if there is interference with the ring, I should clear the interference first by either trimming from the cast or raising the pin. I shift the location of the pin, because at all times of mounting I should make sure that the pin is touching the table. So I might either trim from the cast or slightly just change our reference from the pin, loosen the pin and go down a bit until it touches and with no interference from the ring. The second interference we might have while mounting, it comes from the heels. So the cast, as we have seen, in the upper, it goes down after the hamular notch by the effect of, what do we have behind the hamular notch in the upper? Pterygomandibular raphe. And we also have the same raphe from the retromolar pad going up between the upper and lower. So the shape of the ridges, we have them naturally. In the upper they go down, and in the lower cast they go up. So we're recording what we have in the mouth. So sometimes the trimming of the cast or the way we trim it, we might have some excess of plaster here, okay, or stone. So we want to make sure that the heels are not hitting. Okay, so yes. So look at the heels. If while mounting the heels are hitting the upper heel or the lower heel of the stone or hitting each other, I trim slightly from the land area of the cast here. Also, I want to make sure that my base plates are also not biting on. This occurs especially in patients with large tuberosities, okay? So also the base plates, the lower base plate should not be hitting the upper base plate. And also, I don't want the wax hitting the base plates. So if I'm looking, this is the upper now. And if the upper wax, suppose this is in location, like this, I'm going to secure it. If the upper wax, suppose it's hitting on the heel of the lower cast. In that case, I increase my bevel. Do you remember the bevel we made in wax? This is its function, to make sure that the upper wax does not hit the lower cast or the lower base plate. The upper wax should only come in contact with lower wax. Agree? So if your upper wax is hitting in the heel area of the lower, I increase my bevel area. So I increase the bevel in the upper. So make sure that the heels, once everything is okay, it's centered on the midline. I'm going to now to finalize. So I'm centering it on the midline. I center it posteriorly. So, and the lower is over the lower. I go and look from the sides, making sure that we don't have interferences. In this case, we have an interference here. Okay, minimal interference. I could trim from the cast a bit. On the other side, I want to see if there's an interference or not. I'm going to not trim here. But usually, because these casts are made out of ideal models, go and recheck your wax rims, because sometimes this wax rim is higher than the other. So it's the problem with your wax rim, your measurements. So both sides, the wax rims should be of same dimensions to take the heels away from each other, okay, to enable you to set. So this is our second interference we're going to look. If everything is okay, make sure you, on the lower, you go with the notches. Do you remember the notches? And we also make sure that we soak the cast well, because today I had somebody coming in, the cast is separated from the plaster after mounting, because the cast might have been dry, or the mix of the plaster was dry. So make sure that you soak your cast very well before mounting, so the plaster will not separate. And then when you come back, finally, everything mounted correctly, and then we will begin, inshallah, setting our teeth for next week, inshallah. Okay? So this is your work today. You're going to, first of all, to take a mark for the mounting of the upper. Make sure the upper is mounted correctly. Anybody with one minor mistake, we will leave the mounting there. But if more than two or more, we're going to let you remount your upper before going to the lower mounting, okay? So you can begin now. Assalamu alaikum. Today we will be talking about the setting of teeth, upper and lower teeth, using acrylic teeth for our case. So you have finished the step where you have mounted the upper and lower casts. While mounting, we made sure that the midlines all are in line. We check that by looking at the articulator with the pin. We compare the midlines with the pin, so we can find that they are aligned. And once these midlines are aligned, and as you see here, if we remove the pin, inside the pin, you can see that the midlines are aligned together. We make sure that these lines are all aligned together. The casts are aligned in the mounting, and this is when we are ready to do the setting. We make sure before doing the setting that the pin is touching the table, the screw is secured, and we will present you with the teeth. The teeth are an acrylic mold of teeth. These are a fixed size for all students, and we will be using them for setting the case we have today. So the first step, we draw the midlines and accentuate them. And then we want you to emphasize the arch of the wax. So if we remove the upper, if we take out the upper, and look at the wax here, you can find that the wax has an arch that is like a U shape. We would want to keep the setting of the teeth within this arch. So we can use a pen. Can use this pen and just to draw a line, make sure that the wax arch is clear for you. So we want to make sure that the midlines are clear, so we have a clear midline. It's better to draw it using an ink marker for you to see it, because we want the teeth on the midline. And then we open and we begin drawing on the wax itself. So the wax corner, we just draw this line because we don't want the teeth out of this arch. And just to help you, on a glass slab, the one you will be using for the setting, we take out the upper base plate. We ask you please to put on your base plate, your wax on the base plate, and using the pen, draw around it an arch. So we want to make sure that we are always comparing with this arch around. We're going to do this side of the case of the wax, and you will be doing both sides in your laboratory training. Okay, so we have an arch now, and we're ready to set the teeth. The teeth we are using today are made of acrylic resin. It is similar to the heat cure acrylic we use in dentures, but these are made by the manufacturer. So they use acrylic that is produced under heavy pressure and high temperatures. So they have more cross-linking than the denture material we will have later on the denture base. So they come in sets. These sets have numbers according to the numbers, and they have different forms and different shapes. You will take those later on in a lecture called Selection of Teeth. But what we want to emphasize here, and it's very important for setting, that the teeth sets come in a morphology similar to what you have taken in the dental morphology course. And we are emphasizing here identification of the teeth in terms of left and right of the patient. Okay? So when you set teeth, make sure that you identify which is the mesial side of the tooth and which is the distal. So not to mix up teeth while setting, for example, putting the laterals instead of each other. We will not have the ideal morphology of the arch if we have switch between left and right. We must make sure that we are identifying mesial and distal surfaces of teeth when we are setting. Also, this applies to the canines. We have slopes of canines. The distal is more rounded and longer than the mesial slope, so we need to identify them. This also applies to the molar teeth. When the molars, we still have more confusion sometimes when we are looking at the premolars, because they look very much alike. For the molars, we have distinct occlusal morphology for the 6 and 7 in the upper and the lower. We can easily identify them simply, for example, that the upper is 4 cusps and the lower can have the 5th cusp here. And the cross section, this is it has a bit an oblique occlusal morphology, while this has more like a rectangle. But in the premolars, we need to identify and see the teeth and look at the teeth carefully before we begin setting them, to make sure that we identify the left from the right when we're doing them. The sets of teeth come with a midline, and the teeth are divided equally, and this is where this is my right but the patient's left. This set of teeth begins, and this is the line dividing this set of teeth. So make sure you identify the morphology and left from right before setting the teeth. So now we're going to begin with the setting. We are going to use a wax knife for this purpose. We're going to take out the base plate from the cast, and we might do a window. What are we doing now? We are making space for the tooth that we're going to place. We're going to use a hot wax knife, we're going to do like a window. So if we look closely at this, okay, we are freeing a box for the first tooth to place. So this is an empty box. After removing this empty space, we are placing the central incisor in the soft wax that we have made soft. We're going to make sure that we are on the same side. We place our central incisor and make sure that the incisal edge of this tooth the incisal edge of this tooth is with the what we call our reference. Our reference is a glass slab or a plastic in our case. So the tooth that we have placed is exactly on the same incisal edge of the wax rib. So we also make sure that the incisal edge of this tooth, in comparison with the arc that we had, which is this arch, it's also fitting. So we were checking it that it's still inside the arch. Once we are finished with this, we simply begin melting wax around the tooth to fix it in place. Though making sure that the tooth is in position, it's in the arch form, it's corresponding with the midline, it's on the midline, and the arch of the tooth is going with the arch rotation. We have an overjet. You can see the overjet with the lower, and we're going to fix it in place. So we use a hot instrument, melting wax around the tooth, and we begin freeing more space for the lateral. The position of each tooth in the arch is present in the sheet you have in front of you, and we're going to follow the same rules. So for the lateral position is tilted with an arch. We put it not on the incisal edge of the central, we keep it higher by 1 millimeter. So now it's on the incisal table. We don't want it on the incisal table. We will raise it by 1 millimeter. So we're going to press it into place a bit more, so it will be raised by 1 millimeter from the glass slab. We make sure it's higher than the central. We also make sure that the neck is depressed in the wax. Its neck is depressed in the wax more than the central as well. And it's following the same arch. We are still on the same arch. And then we begin fixing the tooth into location. Once we finalize its position, we begin fixing it. If you want more wax, we can bring from an outside source, and molten wax is spread around the tooth. We put it back and make sure we're still on the same arch. We have the overjet clear from the lower as it was in the first time, and it's in correct location. And now we're going to go for the canine. Once more, opening another box. Now for the canine, it's a cornerstone in the arch morphology. So the canine position is on the turn between the incisal part or incisal section and posterior teeth, which is the posterior junction of it. So it's on the junction between two planes. And the morphology of the canine itself, it has two planes. It has a mesial plane and a distal plane. The mesial plane continues with the lateral, as you could see. But suddenly, from the midpoint of the tooth, it turns to a distal half, and the distal half is rotated to meet with the posterior arch. The position from the wax rim, the canine should be exactly on the occlusal plane that we had originally. So still the canine is still on the same occlusal plane. The mesial half of the canine is with the incisors. The distal half is rotated to the inside, so it will meet with posterior teeth. The long axis of the tooth is upright. You have these features clearly written in the sheet in front of you. And then we fix the canine into position. Okay. So the overjet, if we look from the inside, the overjet continues around, equal between the all upper teeth with the wax rim. So we are now ready to do the premolar, first premolar. For the first premolar, it's the first tooth in the arch for posterior teeth. It's placed behind the canine. Still within the arch, we have drawn on the wax rim and on the glass slab. The cusps that touch are the buccal cusp. The palatal cusp is a bit raised. Buccal cusp touching, the palatal is a bit raised. The central fossa here is in line, will create a second line of reference. Other than the outer line, we will have a second line of reference, which will be the central fossae of the teeth together. So we can notice here the canine rotation. The mesial is with the anterior teeth. The distal of the canine shifts to come in line with the posterior teeth. The buccal cusp is touching. The premolar is upright. Okay, and it's still with the occlusal plane with the anterior teeth. And we're going to fix it into location. So we make sure that all teeth are aligned correctly. If the neck, the teeth should be, canine and premolars should be upright. So if any tilt in the neck of the tooth, we just simply push it into place. The canine, we're using still the softness of the wax. We are pushing the neck of the premolar to make it not tilted but upright. The canine has a slight tilt to the distal, but the premolar should be upright. And now it's on the glass slab and still in the arch. We continue to the second premolar. fixing the teeth into location. A point about fixing teeth. We have to make sure that each tooth has enough wax around it, fixing it into place. Because many times the students, while setting the teeth, have a problem that the teeth begin moving. So we need a reference for the setting. So we want to make sure that we have enough wax around the tooth to embed it and support it, not moving while adding other teeth in. The second premolar is added. We push it into the molten wax. We melt the wax beneath it, and we push it into the molten wax. Okay, and we make sure that it is in line with the other teeth. The tooth is upright. Both cusps are touching in this time. So both cusps are touching the glass slab at this time, and we fix it into place. The tooth is upright, as you see, and the central fossa of the second premolar is going with the central fossa of the first premolar. Premolar added, it's in the arch. The central fossa is in line with the central fossa. Now we remove another box of wax for the molar. The molar is added. It's the beginning of a third line of the arch, which is the most posterior teeth. The upper six has two parts, two halves. As we said, the canine was a cornerstone, and it had a mesial going with the incisors and a distal half going with the premolars. The molar has the same thing. It has two halves. This half is going with the molars, the premolars, sorry, and the distal half will go in another line a bit to the inside, going with the 7. So we have two planes. So the 6 has two planes. So the mesial part of it is going with the premolars and the canine. The distal part will go slightly to the inside, and it will be going with the second molar. We check that the 6 is touching the glass slab only in the mesio-palatal cusp. It's the only cusp touching the glass slab. Why? Because also the 6 is shifting upwards, creating what we call curve of speed. So once we put it on the glass slab, we can see that there is a buccal tilt. These two buccal cusps are not touching. The palatal cusp distally is not touching. The only cusp touching is the mesio-palatal cusp. So what we will have the beginning of the posterior teeth also going up as well, and this is creating what we call curve of Spee. The curve of Spee. So 6 begins, this is where a shift in the occlusal plane occurs to create what we call curve of Spee. And only the mesio-palatal cusp is touching the glass slab. Mesio-palatal. For the second premolar, both cusps, the first premolar only the palatal, the incisor is touching. Lateral is not touching the occlusal plane. Now, when you open the window for 7, tooth number 7, make sure you leave some wax distally. So wax distally will keep space and make you sure that you're still on the occlusal table. We want this posterior reference to stay up to the point where you're going to do a wax up. So when you open the last window for tooth number 7, make sure that tooth number 7, you're leaving some wax distal to it to give you a guidance where was the occlusal table before adding tooth number 7. Because remember, tooth number 7 will not be touching the occlusal plane. It will be higher to create what we call curve of Spee. So we open a window. When we open the window, make sure that we are not making the base plate appear. We're still leaving wax
beneath it. Now, if you have used the accurate measurements for the wax rims and the height of the wax rim, you will not need to trim the teeth. You will have space to add the teeth without touching the base plate. But in some cases where some of you did not follow the measurements, we will have the base plate appearing and still the tooth, we could not place it in place. This is where we do something called trimming of the teeth. We will be talking about the trimming of the teeth later. So take a close look at tooth number 7. Tooth number 7 will have no cusps touching. The central fossa of the 7 is going with the 6. And we are putting it into the wax in a way where its distal end is higher than the mesial end. The mesial end here is with the distal of the 6. The distal of the 6 is the mesial of the 6 is touching the palatal part. So this is where, if I'm putting it on the glass slab here, notice what we call curve of Spee. The teeth are raising in a manner, okay? So all of the teeth touching, but then at the tooth number 6 we begin going upwards, and this is what's called curve of Spee. So we have the teeth going upwards, and then we fix tooth number 7 into place. It's in line with tooth number 6, the central fossa. This is the first line, this is the second line. The molars have a buccal line different than the central fossa line. We will emphasize the lines and the references for our setting once we finish the setting and tell you about them. So we fix the tooth into place. Make sure that the wax supports the teeth in a good manner. We are heating the instrument, making sure that the hot knife is touching both the tooth and the wax because we want the wax fixed to it. We are putting wax in the interdental papilla area between teeth. And then we begin cleaning the wax from around the teeth to finalize the setting. So now we are checking the teeth on the arch we have drawn in the beginning, making sure that all teeth are still in the line of the arch provided for you. So you'll have this arch provided. From the inside, we can see which cusps are touching and which are not. So if I'm looking from the inside, I could see that tooth number 7 is not touching the glass slab. Now, once we have fixed all teeth into the location, we made sure that the wax is surrounding the teeth very well. Okay. Using the tip, we are smoothing the wax on the base plate area, in this area. So any remnants of wax, we just smooth it, as we have done with the wax rim. We are making sure that the wax is going in between the teeth in the interdental papilla area. So the hot instrument is going with molten wax in between the teeth. And then we could use the lacron carver to expose the buccal surface of the teeth from wax. There is another step where we're going to do a wax up, that's later, but just when you're doing submission of the setting, you have to have the buccal surface clean. We need to wait for the wax to totally solidify. And then we begin exposing the buccal surfaces of teeth. We're exposing the labial surfaces of teeth up to the neck, which is the clinical crown area. So no wax should be on the buccal surface of the teeth or the occlusal table of the teeth when you submit your work. The junction of the wax with the base plate should be smooth. We are using now the lacquer carver inverted upwards. You can see with the tip inverted upwards, just to try to clear the final margin of the what will resembles the gingiva in the teeth. We make sure that the pupilla are still filled with wax. We're just exposing the labial surfaces of teeth and the buccal surfaces of teeth. Make sure while setting that no wax goes on the fitting surface of the base plate or the border of the base plate. So any wax around these areas, any wax on the fitting, it should not at any time drip any wax on the fitting surface, because this will not fit on the cast when we put it back. So we need to make sure that no wax has gone into the palatal surface, fitting surface of the teeth. And once you finish this step, after cleaning the teeth, go back and check on the glass slab. It's still fitting and all teeth are touching the glass slab as the rules of setting we have talked about, and which you have as a plate on your paper. So we're going to put it just quickly and check which teeth cusps are touching and which are not. Okay? Because sometimes while cleaning, the teeth move if you don't allow the wax to cool off enough. And all excess wax that has gone into the palatal, we just remove it. We have wiped the teeth with a tissue. All excess wax is removed. A smooth junction should be between the wax and the base plate in this area. So this is the setting of the teeth. This last part, we have just used the flame to gently heat the surface of the wax, not the teeth, and make sure that no wax is still on the teeth. And this is our setting already. And we make sure finally that the cusps that are touching are still all there. Thank you.